Hello, my name is Dr. Michael Wald, and thank you for joining me for what will prove to be a useful discussion on food allergies. As I mentioned, my name is Dr. Michael Wald, otherwise known as the Blood Detective. I am a board-certified nutritionist and doctor of chiropractic. I'm also a dietitian and sports nutritionist. I also provide acupuncture, and I'm a life coach. And sometimes I mix and match all of those various skills given the patient that is before me. And I'll mention some of the uses of my skills during this conversation regarding food allergies, natural and medical approaches. I'll begin with a short disclaimer, basically that this information is for your educational purposes only. It's not meant as a substitute for sound medical or health advice. And also, you should know that although this is a fairly comprehensive talk, it's certainly more information than you'll likely get in years of visits to allergists, particularly if you're not the type of personality that likes to ask questions. So I would encourage you to pay attention because if you become a more educated consumer, that will enhance your relationship with your allergist or whatever healthcare provider you're working with to help you manage your allergic issues. So first I'll start with a basic definition of the immune system, and the immune system is what is reacting to food allergies. So by definition, food allergies must involve the immune system. And sometimes a food allergy can be confused with some other type of physiological disturbance. For example, if someone just has, let's say, enzyme or stomach acid deficiencies, they may develop various reactions, even skin reactions that can mimic true food allergies, which once again, by definition, I should say, should and must trigger the immune system. And the prevalence of food allergies is over 20% of the global population. That is a lot of people. Common food allergies are peanuts, tree nuts, dairy, eggs, shellfish, wheat, and soy. But a person, as most of you know, could have any sort of food allergy from any food, even if it's considered healthy. So in other words, there are people that are allergic to broccoli. Is it a healthy food? Not for those people. And regardless of the food allergy you're talking about, the type of food allergy testing that is mostly performed by allergists are IgG type 1 immunity response testing. So it measures immunoglobulin E, which is a portion of the immune system that responds to immediate food allergies, which could occur, as the term suggests, immediately or within about 3 days or so of ingesting the food. And there are a variety of medical treatments for food allergies. This isn't by any means an exhaustive list, but there's Xolair and what's known as oral immunotherapy. And then there's some emerging therapies in the works. Dupixent, for example, and Allergy Therapeutics, DBV Technologies, and Introimmune Therapeutics. I won't be going into these particular topics here, but I wanted you to be aware of them so you can do your own research. And also, if there's any interest, I can cover those in another presentation. Just reach out and let me know by emailing me at info@blooddetective.com or calling me at 914-552-1442. I should probably also mention that on my website at drwald.com, if you search the search bar or look at the podcast drop-down menu, you will find loads of practical information on food allergies. So what are some of the natural treatments for food allergies? Because sometimes the medical therapies, they fall short. And sometimes a combination of both medical and natural therapies is what the doctor ordered. And other people, particularly those that visit me, they don't want to receive the standard medical care, or it hasn't worked for them. So they finally realize that they need to improve their total nutritional health so that their body can more favorably manage various food allergies. So these are just a few different supplements that are considerations. What I like to do with each person is first to identify what nutritional deficiencies they actually have. Because if you have deficiencies, let's say of folic acid, even though it's not on my food allergy nutrient list, you won't respond normally to these nutritional suggestions that I'll be giving you here if you lack other nutrition. So we always want to first start out with what are your particular nutritional issues, and then consider the supplements like this and food suggestions like I'll be reviewing right now. So for example, turmeric, which is a strong anti-inflammatory, it also supports the immune system, can help people deal with type 1 hypersensitivity food reactions, even type 2 reactions. And then there's ginger. green tea, and omega-3 foods. And then you want to eliminate highly inflammatory foods in your diet, even if you're not allergic to them. That's an example of a reaction in the body that's not allergic, but is inflammatory, but nonetheless affects one's overall health. And that gets a little tricky too, because what is a pro-inflammatory food for one person may not be an inflammatory food for another. So there are tests and other techniques to figure that out. And then there's food rotation, which basically helps, the basic concept of that is avoiding repeated exposure to potentially allergic foods that may therefore reduce sensitization if you're simply not eating the foods often. It's the foods that you eat most often that are likely the culprits in your food allergies. Sometimes people think it's the opposite. So what about the gut microbiome and food allergies? Because although allergists know that the gut is fundamentally related to food allergy reactions, you have to digest food and then react to it, or sometimes you don't. You have an exposure to food. As soon as you put it in your mouth, there's no digestion and you react to it. But nonetheless, in many cases, the gut is a problem. It needs attention. Immune cells in the gut distinguish between food and harmful pathogens. And nutrients like probiotics, lactobacillus, bifidobacterium, which by the way is best for children under 7 to deal with food allergies, help strengthen the gut lining and reduce inflammation. And then there are prebiotics, which are fiber-rich foods and fermented foods. They help, once again, modify the immune response and quiet it down in the intestinal tract. And also, these various factors I'm speaking about now help remove foods more quickly from the intestinal tract. And then there's reducing processed foods and artificial additives to lower the load of inflammation. So let's talk more specifically about and practically about some nutritional supplements that you might want to consider, because the allergists, the internists, those that are dealing with food allergies and nutritional medicine, they know very little about nutrition. And this to me is obscene, because without proper nutrition, you cannot have a proper functioning immune system. You cannot have a properly functioning digestive system. You cannot control inflammation normally. So let's start with vitamin D3. On a blood test, you want your range of vitamin D3 to be between 50 and 70. And 70 to 80 is optimal. The higher normal the vitamin C level, the lower one's overall risk of dying of anything. And you want proper vitamin D stores, not just a barely normal range at 30, 35, 40, which most doctors seem to be satisfied with. We know that vitamin D3 supports immune function, and a deficiency leads to higher allergy risks, worse reactions from allergy exposure. And then, of course, people try to get their vitamin D from the sun, but that really will not work for a variety of reasons. One reason is by exposing yourself to that much sun, you might be increasing your skin cancer risk. But you can get vitamin D from fatty fish, and then, as I've mentioned, supplementing. And the amount of vitamin D must be based on your testing. And then there's quercetin, which is an antioxidant and a very strong anti-inflammatory and antihistamine, because type 1 food allergies, the ones that produce immediate symptoms like wheals or allergic hives on the skin, they release histamine by definition. And quercetin, by reducing the histamine, also stabilizes mast cells. When mast cells are unstabilized, those mast cells will release histamine. And histamine, again, generates the various reactions. And then a little bit more about the omega-3s. We know that omega-3s help reduce inflammation and help to balance the immune system overall. And omega-3s are found in flaxseed oil, but flaxseed has omega-3s, 6s, and 9s. I listed it here, but I don't really suggest that people go there first. You want a pure omega-3 fatty acid that has a higher ratio of EPA to the DHA portion of the omega-3s. And there's walnuts, chia seeds, and fatty fish. You want to have those walnuts raw. If you heat the walnuts, then you roast the omega-3 fatty acids, and that causes oxidation of oils, which can promote inflammation and worsen food allergies in the body. And then there's zinc, the old favorite. Everyone knows about zinc. What most people don't know, I find in my practice, is that if you have symptoms, let's say like sore throat, zinc gluconate is the best form in a lozenge. Zinc gluconate is not well utilized systemically, which is why various companies that produce zinc lozenges use zinc gluconate in the lozenge because it acts locally. But other forms of zinc, like zinc picolinate, for example, zinc citrate, and there are others, they boost immune function. And what I really should say, not boost immune function, regulate immune function. Because if you have a hyper-responsive IgE immune response, you don't want to boost that. You want to mitigate that. You want to lower that. So you want to regulate immunity, and zinc does that. And zinc is also found in a variety of foods like pumpkin seeds, again, raw seeds, spinach, almonds, and seafood, as I've mentioned. And a fundamental aspect of a strong immune system is the proper proteins. If for any reason we need proteins as precursors to make immunoglobulins. And immunoglobulins are part of the immune system, and we want to make sure that enough protein is there so the body can balance its immune response to allergy exposure. And then there are oral immunoglobulins. They actually make these in powder and capsule forms. They're usually immunoglobulin G, which helps regulate the immune response. There is a company called Metagenics that makes those types of immunoglobulins. And then vitamin C, which is another fundamental nutrient just like zinc. Vitamin C is needed for a variety of reasons, but it's important to know that a good deal of your vitamin C is stored in your adrenal glands, and your adrenal glands deal with allergies. They also deal with all manner of other types of stress. So allergies are a type of physiologic stress. Then there's inflammatory stress, there's the stress of getting older, the stress of repairing, the stress of responding to exercise. So we need vitamin C, plus it's needed for over 3,000 enzymatic reactions in the body. And I like to give vitamin C based on what's known as a buffered vitamin C bowel tolerance test, where I have a client take a level teaspoon of buffered vitamin C, which is buffered with various minerals, and they will do that in 2 to 3 ounces of water every 30 minutes until they get diarrhea. That means the body's fully saturated. Then they stop that procedure. It may take them 1 level teaspoon. It might take them 10 level teaspoons. But whatever the number of teaspoons is, 2/3 of that amount is what the person needs daily to be saturated with vitamin C and get the best anti-allergic effects. As far as turmeric, 500 milligrams to 6,000 milligrams are anti-inflammatory and antihistaminic doses. And usually when I sit with a client, there's a lot of factors that go into play when determining dosages. One that's not often talked too much about, but is essential as far as I'm concerned, is a body composition analysis. Knowing one's metabolic rate and knowing their percentage of muscle, water, and fat, particularly the lean mass, which is muscle and organs, knowing that lean mass, I base my nutritional dosage per kilogram of lean body mass. Otherwise, we're just guessing. And then there are digestive enzymes. What possible role could digestive enzymes have in allergies? Well, a pretty major one. Number one, a person can be allergic to foods because the intestinal tract has inadequately digested the foods. So they're larger particles, they're not as friendly to the digestive system, and an allergic reaction can result. And sometimes, even if an allergic reaction doesn't result, an adverse food reaction can result if you're not breaking down the foods. So obviously, digestive enzymes in the form of protein, carbohydrate, and fat digestive enzymes orally are a very good idea, unless there's some contraindication for that, like ulcers. And the other thing I should mention about digestive enzymes is that if you take the enzymes with food, they help you digest the food. If you take the enzymes an hour or more away from food, there may be some digestion being helped with the enzymes, but those enzymes, when you take it on an empty stomach or nearly an empty stomach, will be absorbed and diffused through the intestinal lining into the blood. And these digestive enzymes help to digest allergic components like IgEs. That's an amazing fact. I found out about that over 30 years ago. That knowledge is old. I've never heard of a single allergist or internist or even gastroenterologist recommending digestive enzymes. And then there's stinging nettles and butterbur and bromelain, another enzyme, which help to manage and lower histamine levels. Now, what I won't be mentioning throughout this talk, other than right here, is that there is what is known as a histamine or antihistamine diet. And you can look that up on your own. But the problem with that diet is, again, it doesn't know the individual's specific allergies. So they could be eating foods that are said on paper to be antihistaminic, but they're not for that individual. So you want to correct any underlying nutritional issues, as I've said before, with a person. If you just run out to the health food store and purchase omega-3 fatty acids, vitamin C, zinc, you might help yourself. Most of the time, though, people get the doses wrong, they get the timing wrong, they're combining nutrients improperly, or they get the nutrients right, but their diet is just absolutely wrong, or there are other stressors in their life that help to stress the body so much that even when a person makes some correct steps, it doesn't work. So in more difficult allergies, it's important to approach this holistically, which I'll speak about more what I mean by that in a moment. I mentioned vitamin D before. I won't go into it again. I mentioned omega-3s. I want to reemphasize, though, that you want omega-3s. You do not want to load up on omega-6 fatty acids like evening primrose oil. I've seen clients come in and they had been on the wrong fatty acid. Omega-3s are pro-inflammatory. Omega-6 fatty acids are pro-inflammatory. Omega-3 that you'll find in fish, for example, fish oil, those are very strongly anti-inflammatory. And then there's glutathione. Glutathione is what is known as a tripeptide. It's made of 3 amino acids. It is a substantial immune molecule in the body. It is a strong antioxidant. It is essential for detoxification of hundreds of different toxins and allergens. And when I say that, I really mean that. Glutathione, if you look up in a toxicology textbook on the various liver detoxification systems, some of them require the conjugation ones, like type 2 conjugation detoxification in the liver, require a glutathione. Glutathione can also be increased by taking other nutrients like N-acetylcysteine, which I'll be talking about. Well, actually, I'll mention it here. NAC, or N-acetylcysteine, is one of my favorite supplements. It is antiviral. It is anti-infectious overall. It increases glutathione levels in the lungs within 20 minutes of an oral dose. NAC is a heavy metal chelator, which simply means it chelates or binds to metals. And if you have metals, by the way, that may be stressing your immune system out, and then you might respond in an allergic way to foods that previously you were not allergic to. This point needs some emphasis. So if you have lack of sleep, or you're underhydrated, or you have some sort of other stressors, they can weaken your immune system to the point where you do not tolerate certain foods and you react to them as allergens when before you had greater resiliency and you did not react. Once again, that's why a holistic approach to looking at someone's entire lifestyle and entire health picture is ideal when managing food allergies. And then there's a methylation profile. Some people have what's known as poor methylation, and they have a problem with a certain gene called the MTHFR gene. And we need that gene to be working appropriately to process histamine effectively. So that is a test that's performed by all the major labs. And good methylating nutrients would be methylated folic acid, methylated B12 as 2 examples. And then we, as I've been emphasizing, stresses the immune systems. And I say immune systems because we have a minimum of 3 branches of the immune system. So we have the immunoglobulin immune system, which is known as the humoral immune system. We have the cell-mediated immune system, where cells mediate the immune response, like neutrophils or eosinophils. And we have the complement immune system, which is a system that complements or balances the humoral and the cell-mediated immune system. And these immune systems sometimes require different nutritional and lifestyle approaches to improve them. So we want to acknowledge that chronic stress weakens the immune system and increases allergic reaction potential. Practices like meditation, deep breathing exercises, and yoga can effectively reduce the stress response in the body, which makes allergic reactions, generally speaking, less prominent, or less severe, I should say. And then there's acupuncture and traditional Chinese medicine. As someone who provides acupuncture, I have not found it particularly effective in food allergens, but other people have said it works for them. And environmental factors such as heavy metal toxins, like I just mentioned, molds, inflammatory foods, and various other allergic triggers can make you more susceptible to other allergens. Once again, holistic, holistic, holistic. And then in medicine and overall, when I'm educating patients in this topic, I usually let them know about the skin prick testing or the SPTs, which can help allergists determine the food reactions in a person. They will take a small amount of the food there's a whole bunch of foods that are checked, and they're put in certain locations, let's say on the back, and then they look for an IgE reaction like redness and swelling. And you can also, that test is also valid for non-food allergic triggers. And then there's a patch test, which tests delayed allergic reactions. And oral challenging tests, which is a gold standard under controlled administration of the suspected allergen. And there's what's known as an elimination diet. Let's say you think you're allergic to gluten, you eliminate it for 2 weeks, then under supervision, medical supervision, you introduce the gluten back, and then you see if you'll react to it. You will know. And then there's the IgE antibody test. There's either RAST testing of that type and Immunocap. Both are IgE antibody tests. And then you want to have a basic blood test that includes a complete blood count to look at the eosinophils, which is one of the types of white blood cells which is characteristic of allergens. Although an increased eosinophil number can also be from parasitic infections and some other conditions. And then there's a histamine release test. White blood cells released histamine. So this test is useful for assessing histamine release. And there is a cytokine panel, a zonulin and intestinal permeability test, and C-reactive protein. Let me go back on two of these. The zonulin and intestinal permeability tests are not tests that traditional allergies or even primary healthcare providers or family doctors tend to do. That's because they have not gotten education in it. But intestinal permeability is a hallmark of allergens of all types. So that test can let us know how the intestinal tract has been coping or has been affected by various food allergens. And C-reactive protein is an inflammatory marker, and no matter what increases it, for example, if you're allergic to a food and it increases your C-reactive protein, that has increased your cardiovascular risk. That's not a joke. You might say, really, what is it? How can a food allergy do that? Well, one of the basic ways a food allergy can increase cardiovascular risk is by promoting an inflammatory process. And the inflammatory mediators produced in response to a food trigger are circulating, and they can damage the inside of blood vessels, causing atherosclerosis, for example. I could go on. There's many ways in which food allergies can increase cardiovascular risk and risk of other diseases, like a variety of autoimmune diseases. So fundamentally, what I would consider my blood detective workup consists of a comprehensive stool analysis, a urinary and blood levels of vitamin C, and also absorption tests or tests of malabsorption, tests of inflammation, a probiotic sensitivity test, which actually can help determine the proper probiotic for you. And then there's another important test that almost no allergists perform, known as a DAO enzyme activity test. Low diamine oxidase, or DAO, indicates histamine intolerance. And then you can have that as a baseline for all your natural therapies or medical therapies to see if they're working properly. And then, as I mentioned before, glutathione and N-acetylcysteine, there are glutathione and NAC, N-acetylcysteine, response tests, because proper antioxidant balance is essential for dealing favorably with allergies, not just reducing the allergic reactions, but improving your body's resiliency against the allergens, not to mention your overall health. So thank you so much for joining me today. I'd love your feedback, and let me know if there's any aspects of this basic conversation about food allergies today you'd like me to go into a bit more. You can email me at info@blooddetective.com. You can call me at 914-552-1442. And as I mentioned earlier in this podcast, there's plenty of other information on food allergens on my website that you can search the search bar at drmichaelwald.com. Thanks for joining me today, and I'll see you at the next one.